All right, let's talk about something we see every day but maybe don't really understand. Our skin. It's way more than just a covering. It's our bodyguard, our thermostat, and honestly, it's a window into what's happening inside our bodies. So let's dive in. And here's a fun fact to start us off. Your skin is actually your body's largest organ. Yup, the whole thing. Its main gig? Protection. It's the ultimate shield, keeping all the important stuff inside safe from the world outside.
But it's not just a passive shield. Your skin is constantly talking to you, sending out signals about your health, about what's going on around you. So, are you listening? That's what this is all about. We're going to learn how to decode what our skin is trying to tell us.
Okay, so to really get this, let's start by looking at it from a professional's point of view. How do experts actually assess skin? It's a really interesting process, a mix of listening and, well, looking.
It really boils down to two types of information. First, there's what they call subjective data. That's basically your story, what you tell them. You know, it's been itchy for a week, or I noticed this new spot. Then there's the objective data. That's what the clinician can actually see and feel for themselves. You absolutely need both to get the full picture.
So when they do that physical check, the fancy word is palpation. They're basically like detectives looking for clues. They're feeling for things like temperature, moisture, and the overall texture. They also check for something called turgor, which is just a cool way of saying skin elasticity. You know, when they gently pinch your skin, does it snap right back? All of these little details give them big hints about things like your hydration levels and how your circulation is doing.
So what does normal even look like? What's the baseline we're aiming for? Well, for skin, you're looking for even color in that good springy turgor. For nails, they should be pinkish and smooth. And for hair, think shiny and full. This is kind of the gold standard that everything else gets measured against.
Okay, now that we know what healthy looks like, let's get into some of the more common problems you might see, starting with rashes and infections.
Dermatitis sounds complicated, but it's really just a general term for skin inflammation. But here's the thing, it's not a one-size-fits-all deal. You've got atopic dermatitis, which is often genetic, think eczema. Then there's contact dermatitis, which is exactly what it sounds like, your skin reacts to something it touched. And seborrheic dermatitis, that's the stuff linked to yeast and oily skin. Yep, like dandruff. Figuring out the cause is everything because that's what tells you how to treat it.
All right, let's talk about one you've probably heard of, shingles. What's kind of wild about shingles is that you don't catch it like a cold. It's actually the chickenpox virus you had as a kid coming back for an encore. It can just hang out dormant in your nerve tissue for decades, and then boom, it reactivates.
So how does this happen? It's like a four-step process. First, the virus is just sleeping in your system. Then, something, often stress or a weakened immune system, acts as an alarm clock and wakes it up. The reactivated virus then travels down a single nerve path. That's why the rash almost always shows up in a very specific stripe or band on just one side of your body. And that's when the really painful, blistering rash appears.
And of course, there are plenty of others. You've got impetigo, a super contagious bacterial thing. Then there's tinea. That's the whole family of fungal infections, like athlete's foot or ringworm. And then, for something totally different, you have scabies, which is this incredibly itchy rash caused by teeny tiny mites. The main point here is that infections aren't all the same. They can be bacterial, fungal, or even from little critters.
Okay, shifting gears a bit, let's move on to more serious skin injuries, things like burns, major wounds, and ulcers. These are situations that often need immediate attention.
And one of the most critical conditions is something called compartment syndrome. This is a real medical emergency. What happens is, after a bad injury, like a severe burn or a crush injury, the swelling inside a limb gets trapped. The pressure builds and builds until it's so intense, it actually squeezes the blood vessel shut, cutting off blood supply. This can kill off muscle and nerve tissue, and fast.
So, how can you spot it? There's a handy mnemonic clinicians use called the 5 Ps. The first, and maybe most important, is pain. But we're talking pain that is way, way worse than you'd expect for the injury. Next is paresthesia. That's tingling, or a pins and needles feeling. Then you have pallor, where the skin looks pale and white. The last two are really late, dangerous signs. Paralysis, not being able to move the area, and pulselessness, meaning no pulse. Those first two, pain and paresthesia, are the critical early warnings.
Another really serious problem is pressure ulcers, which most of us know as bed sores. And you know, it's easy to think they're just from staying in one position too long, but it's way more complex than that. The biggest risks are actually being immobile, not getting enough nutrition, and having poor circulation. So, in a way, they're a direct reflection of someone's overall health.
So how do you get ahead of this? Well, in hospitals and care facilities, they use a tool called the Braden Scale to predict who's at risk. It scores people on a bunch of factors: mobility, nutrition, moisture on the skin, and so on. A patient gets a score, like this one, 11. So what does a number like 11 actually mean?
It means that patient is at high risk. A score in that 10 to 12 range is a major red flag for the whole healthcare team. It tells them, hey, we need to start preventative measures for this person right now. It's a perfect example of how a simple scoring system can launch a really important plan of action.
Okay, let's move into our final section, and honestly, this is probably the most important one: decoding skin cancer. Really understanding the risks and the warning signs is one of the most powerful things you can do for your health, full stop.
So, there are a few main types of skin cancer. You have basal cell and squamous cell, which are actually pretty common. But the one we really need to pay attention to is melanoma. It's not as common as the others, but it's far more dangerous. Why? Because it has a much higher chance of spreading to other parts of the body if you don't catch it early.
So if there is one thing you remember from this entire explainer, please let it be this. When you're looking at moles on your skin or anyone else's, you need to remember your ABCDs.
Let's break that down. A is for asymmetry. Imagine drawing a line down the middle. Do the two halves match? No? That's a warning sign. B is for border. Is the edge smooth and even, or is it ragged, notched, or blurry? C is for color. Is it all one shade of brown, or are there multiple colors? Black, tan, brown, even red or blue? D is for diameter. Is it bigger than a pencil eraser? And finally, E is for evolving. This is a huge one. Is the mole changing over time? Is it getting bigger, changing color, starting to itch or bleed? Any change is a reason to get it checked.
And why is this so critical? Because sun damage is cumulative. Think of it like a running tab. Every single sunburn, every tan, every minute you're outside without protection, it all adds up over your entire life. So, what's the game plan? It's actually pretty straightforward. First, protect yourself. Avoid the sun during peak hours, and please stay away from tanning beds. Second, be your own detective. Use that ABCD guide to check your skin, maybe once a month. And third, and this is non-negotiable, if you see anything that looks weird, new, or changing, go see a dermatologist. Don't wait.
Look, from a tiny rash to a mole that's just a little bit different, your skin is always telling you its story. The question is, now that you know a little more of the language, are you going to listen? Paying attention to your skin isn't vanity, it's health, and it could literally save your life. Thanks for tuning in.